Hi, this is Vivian Rain with Dr. Bizboom, and I wanted to do a quick video to discuss introducing the Part 2 video to a patient. This might seem like a very small point, but we have to be great at every part of the cycle, and this little transitionary point should be given its due importance. So just to review, and so we're all on the same page, what's happened here at this point in the cycle is the new patient has come in. They have gone through their eliminating factors and introduction. They've seen the exam. They've had an exam. And now they're going to be moving on to the ROF. In between the exam and ROF, they're going to be played this video. And so I just want to make sure that we're correctly introducing the video. And there's a way to do it, and there's a way to do it not as great. So we want to make sure we're all doing it the best way possible. With that said, what happens is when a patient finishes their exam, we need to make sure to have the correct tone. Now, what do I mean by that? A patient is going to be as concerned about what's going on with them as you are. That's an important datum to understand and keep in mind. Your job is not to make the patient feel good right now at this part in the cycle. Your job is to be whomever the patient needs you to be and communicate with the seriousness that it deserves what's going on with them and your concern about it so that they don't make light of it. And that's not always comfortable, and that's okay. It's important that we be willing to do that. Now, in this part, when you're moving into the part 2, right, I want to get a couple things super clear here. Every patient should see it. I get it. It's 15 minutes long. Okay, that's fine. What we're going to do is we're going to take that time while the patient is spending 15 minutes on this video, and we're going to prep a few things. We're going to get the care plan written out. That's important. We have to have the care plan written out by the doctor and signed by him so that you have a treatment plan recommended by the doctor and or nurse practitioner, depending on what you're delivering. You also need to make sure that you take their exam scores and you print a nerve map. The nerve map needs to be used in the ROF. So I want to make sure that you have time to do these things. You also need to print out their treatment plan, the full recommended treatment plan with the pricing sheet, the program agreement, whatever it is you need to have to get that patient enrolled needs to be prepped while they're watching this video. That's going to take you a good 10 minutes anyways. So that should be what's being done during this time. The case manager or doctor or whomever is going to be doing the ROF also needs to be given the patient file. They should read through it. They should understand who this patient is and be preparing to go into this cycle. Now, let's talk about what's said to the patient. Ideally, it's either the doctor or the case manager releasing the patient to the part 2. And they're going to go immediately from the part 1 to the part 2 to see the video. Just as a reminder, they need to have the decision maker present. That is their spouse or immediate family member involved in their health and financial decisions. Do not do the ROF without those people, period. If that's not your office policy, to be honest, it should be. So let's assume that they have who they should have with them there, and you're doing the part 2. They get roomed wherever you need them, and you start the video, and you say, now I know that the doctor is very concerned, and although sometimes we do this on, and we have a patient come back, he's concerned enough that he wants to do it right now. He's going to take a look and complete your diagnosis, and we're going to see, if we can help you. So we want to give you some more information about what happens as neuropathy progresses and what your potential treatment options are. This video will give you a little more information, and it will give us about 10 to 15 minutes to get these things prepared for you so we can give you the information and see if we can help you and accept you into our care. That should be the type of delivery. It should be a push away, and it should be something where they should be thankful that you're giving them this information, that you're letting them watch this video, and you're taking the time to do this for them. So the wrong way to do this would be like, okay, come on in here. All right, we're going to play this video. We'll be back in a bit. Don't do that. It's just an inadequate job, and it's inadequate patient care. It's not 5-star service, which I know your office does. So take the time and do it right, and take the time to really explain to them what's going on, that we're going to see if we can accept them. The doctor's concerned, they have significant signs of nerve damage, etc. All of those things, and that we need to get their care plan, their diagnosis. The doctors need to confer with the case manager, and we need to get everything prepped so that we can let them know what's going on, and see if we can accept them into care. This needs to be the tone and the delivery in your cycles, but specifically at this part. So I hope this helps, and keep those part 2 videos playing, and keep educating these patients and caring for them and letting them know how serious this is. If you don't know this about me, I am the daughter of an amputee. So from me to you, thank you for the efforts you put in every day to help these people not suffer that type of future. And this is a key step in this cycle of enlightenment and healing for them, that they be given the true gravity and seriousness of what they're dealing with in regards to neuropathy. And if it's a joint or orthopedic issue, it's no different. It takes their mobility and robs them of their ability to enjoy life, and they deserve better than that, and we can give it to them. So here's to all the people you'll heal today, and thanks so much for watching. We're here if you need us. Bye-bye.